So the metacarpals, this finger is always digit 1. Your thumb is digit 1. This is digit 5. So 1, 2, 3, 4, 5. Okay. So then your metacarpals are going to be here. The bases are at the bottom. The shaft is here, and the heads are more distal. So the base is down here, the shaft is here, and this is the head, this bulbous part here. So 3rd, 4th, and 5th metacarpals. Yep, the head is distal. That's the thumb.
So this is the head.
Is the head the knuckle?
Yeah. Like the knuckle, kind of, because you don't want to confuse it with the MCP joint. It's really the head of the metacarpal. Is the bump, and I think the knuckle is like the joint.
So right before the knuckles.
Yeah, it's the proximal portion of the knuckle. Then distal to that, so right, we have your metacarpals, and again, digits 1, 2, 3, 4, and 5. Then you have your proximal phalanges. So all 5 fingers have a proximal phalanx. So that's the next bone. And it has the same kind of configuration of a base, a shaft, and then a head at the end. But we don't ask that. We just ask you to grab kind of like the shaft. So this is the proximal phalanx. Makes your MCP joint. So it's right before, it's the bone before the next joint where it bends. Middle phalanges, so middle phalanx is only on digits 2 through 5. So the thumb only has a proximal and a distal. Middle phalanx is here, kind of in the middle. And it'll ask for the middle phalanx of a specific finger. On the practical, I think it asks for like the middle phalanx of the 4th finger, something like that. Distal phalanges, so all 5 fingers have a distal phalanx. So that would be the ones at the tip here at the ends, 4 and 5. So MCP stands for metacarpophalangeal joint. And those joints, those are your knuckle joints. So that's gonna be here. And all of the fingers have one of those too. So there's your metacarpal, your proximal phalanx where it bends right here is your MCP joint. Not that one, this one here. So these are your MCP joints. And then the MCP joint of the thumb. PIP joints, so the thumb only has an IP joint. So this is the interphalangeal joint of the thumb, MCP joint of the thumb, CMC joint of the thumb. This is the MCP joint, and this is your proximal interphalangeal joint is on digits 2 through 5. So here, 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 here. It's that first kind of fold in the skin, right at this point. So this one. Your DIP joint is at the end, so go ahead and bend. So those again, this is just an IP joint, this is the distal interphalangeal joint, and that's gonna be this one here. And that's on 2 through 5. Okay. And then the first CMC we spoke about here is gonna be at the base of the metacarpal. We already palpated the trapezium, we know where that is. So it's where that movement in the thumb occurs, over here. Okay, so extrinsic muscles, we haven't gotten to it yet, but there's the muscles of the hand are divided, and we divide it on the practical the same way. They're divided into extrinsic and intrinsic muscles. So your extrinsic muscles start either, like they start outside of the hand and they insert into the hand. So that could be your long finger flexors, your long finger extensors. Your intrinsic muscles start distal to the wrist, they're within the palm. So on the practical exam, so again, if we're in the anatomical position, this would be the anterior portion. So your anterior extrinsics, you have your FDP, that stands for flexor digitorum profundus. that was on your online module. And a few people got it wrong too. So your flexor digitorum profundus, most of your long finger and wrist flexors start, where do they originate? The media epicondyle. So they're gonna come from here and they're gonna insert all the way into the distal phalanx of digits 2 through 5. So where you can palpate your FDP, so it's gonna be the only muscle that causes DIP flexion. So if you block, go ahead. If you block flexion at the MCP and the PIP joints and you palpate here, you will feel that tendon wiggling right here on the middle phalanx.
Of any of the 2 through 5 fingers.
You can feel it at the DIP joint or you can feel the tendon here.
You're walking right here.
Yeah, you're blocking the rest. So I'm holding her finger kind of in extension and I'm blocking the PIP joint from bending. See, and just the tip of her finger is bending. So that's how you isolate the FDP. So this is a digit blocking exercise too. If you need to facilitate DIP flexion, you can put it in a position, oh, sorry. You can put it in a position here too, and then that'll put tension, go ahead. And then they'll get more range too. So kind of using passive insufficiency to actually help it. FDS. The flexor digitorum superficialis, again, is gonna come from that medial epicondyle, but it crosses over the MCP joint, so it's mostly responsible for PIP flexion. So FDP causes DIP flexion, FDS causes PIP flexion. So you block the other fingers, and then go ahead and bend your finger. So see now the DIP, when she's here in this position, if you hold the other fingers in extension, and then you block, or you just do one of them, you could, whichever finger that we ask for. Oh, that's a little trickier. But basically, when you put it like this, the DIP doesn't flex anymore. You quiet the FDP. See? So you're isolating PIP flexion in this way, and that's the FDS. The FDS comes across this way and it inserts onto the sides of the middle phalanx. So you can palpate before the split, usually kind of on the proximal or at the MCP joint in this position as you're isolating. So do you feel that tendon here? As you're isolating PIP flexion, you feel the tendon and you see it too.
I can feel it.
Yeah. So you isolate, that's how you isolate that muscle. Okay. Flexor, so then FPL is the flexor pollicis longus. So digitorum is going to be digits, right? Pollicis is, if you see the word pollicis, I want you to think thumb. Just like carpals, we think wrist. Digitorum, you're going to think fingers. Pollicis, anything pollicis is thumbs. So we know it's an anterior extrinsic, so we know it's going to be palpating like the long tendon. So the flexor pollicis longus is responsible for thumb IP flexion. So it's going to bend the last joint of the thumb. So you're going to block the other joints and you'll feel the tendon. You got a little like nodule too, like I do.
There's nodule.
Like a little ball of, like, do you see those little balls there on my tendons here? Do you want to feel it? You see them?
Like on the tendon? I don't have any pain.
Do you feel that?
Yeah, I guess so.
Yeah, that little ball.
No, I don't feel any pain.
Mine gets stuck. All right. So, again, blocking MCP, CMC flexion, you're isolating the IP joint, and then you'll feel the tendon move here. Now it's posterior extrinsics.
Yeah. So APL.
All right, so it's the APL and EPB. Where are those? That was a question on our test. First dorsal compartment. So APL, EPB, when you do your snuff box. So make your snuff box. Good, good, good. Up, up, up this way. So here's her snuff box. So when she makes her snuff box, there's gonna be 3 tendons. So hers is harder to see. I might show mine. See 1, 2, and then see this third one over here? So see 1, 2, and then there's a third here. Everybody see that? 1, 2, 3. It's short. It inserts into the base of the metacarpal. Yeah. The APL inserts, like it literally ends right here. And students all the time tell me like it's up here on the side. It's right, it ends here. The tendon inserts right there. These tendons go up higher, but that APL inserts just to the metacarpal here. So see 1, 2, and then there's, see how this is fat here? You can kind of see if you want to press in between, there's 2.
Okay.
There's like in between, there's
Oh.
1, and then there's 2.
It's right here.
Yeah,
Right?
1,
One and then 2.
2. Mm-hmm. So this is your first dorsal compartment, is this part here. 1 and 2. So it's gonna go in the order, like. Yeah, there's 2 here. Here, feel on me. See 1, see 2. 1, 2. You see
So this one?
Yeah, that's the APL. So abduct a little more. There's your EPL. There's your, that's your EPL, EPB. Yours. Your stuff box for me? Up, up, up. Right here.
Is that, would you consider that one the third or the first?
No. So the way it's right there. It's in, so it's in a compartment together, right? So do you remember the pictures of that dorsal compartment? They're wrapped together, and then after they're wrapped together, they're gonna be like deviate. So they are kind of bind. It's gonna look like one fat, and then after the dorsal compartment, you'll feel the 2 tendons. So they are together. APL, EPB are gonna be, they're tied together in a dorsal compartment, right? And then you're gonna see the, on mine you can kind of see the 2 split after the wrist. And the APL inserts right at the base of that metacarpal. The EPB goes, it's slightly. So it's gonna go APL, EPB, EPL.
Can you do that again?
APL, EPB, EPL.
So this is the one on the side? And then
APL, EPB, EPL.
Okay.
So it's in the order that it is on your sheet. And it's in that order on purpose because you're working from the outside in.
Yeah, on yours it's not.
So the APL is going to be more on the outside. APL, EPB, EPL. So these 2 join together in the first dorsal compartment. APL, EPB join together at that first dorsal compartment. The APL you are going to palpate more like on the outside, and it's going to insert right into the base. You don't palpate it up at the shaft. You palpate it literally right there at the base of that metacarpal, and then right next to it, it's binded to it, is going to be your EPB. Your EPL is this long guy, so that is responsible for IP extension. It is the antagonist to the FPL. So when you block the FPL here, this EPL, it's gonna loop around the Lister's tubercle. Okay, it comes around here. So this long guy, that's your EPL. All right. So APL, EPB, again, right next to each other, first dorsal compartment right here. APL, EPB. One's EPB is gonna go slightly beyond the APL, but again here, don't palpate up here. EPL goes all the way, is responsible for the IP extension. Okay, now the next 3, also pretty easy. I think so. So we're gonna start, so just so that you know what they are, there's extensor indices is EI. Extensor digitorum is ED, and extensor digiti minimi is the EDM. Okay, so for extensor digitorum, good. We're gonna have them do this like claw hand. these tendons that are very prominent with that claw hand, that's your extensor digitorum. Okay, so they're responsible for MCP extension.
What was that? I'm sorry.
MCP extension.
No, what's responsible for that?
Extensor digitorum.
You're doing the
That's your
hand like
extensor
this,
digitorum.
and then you're looking over here, you're saying? Okay.
So
All three?
then your pinky and your index finger have their own extensors. So you could isolate them, right, a lot easier than you can for like the other two. You can't, they don't have their own extensors, but these do. And functionally that makes a lot of sense. We do a lot of things this way that it makes sense that your index finger would have its own extensor. Not 100% sure why we could stick our pinkies up on their own, but like functionally I haven't figured that out yet, but it has its own extensor too. So we could do our rock on sign. So basically to isolate those, again I'm gonna use me because mine are prominent. Do you see how there's two tendons there? Everybody see how there's two tendons here? Okay, so, and then same thing here. Do you see like how this is a little bit fatter? There's actually, when you palpate, there's still two tendons at the MCP of your pinky as well, your fifth digit. So these two, the extensor indices and the extensor digiti minimi are both ulnar to the extensor digitorum. So you're gonna kind of have them isolate in the rock on side. And the one that's more ulnar is the extensor indices and the extensor digiti minimi.
Can I see? You said there's two? Oh, wow.
That's the, so the one that's more ulnar, that's the extensor indices.
And then that's the,
Extensor digitorum. So that's the extensor
okay,
digitorum.
okay.
And then when you isolate
Wow.
these, you can see.
Can't
And then
see
the
that
same
in
thing.
me at all.
You'll find it.
The pinky one is the EDM.
And then if you feel here, I know, I don't know.
Okay. And that's the EDM.
Yes. Yes, you got it.
So the extensor digitorum minimi, that's the index finger, there's two there?
Extensor indices, you see you have one too. And the one that's more ulnar is your extensor indices. And then the
Okay, and this is the extensor digitorum minimi.
No, digitorum.
Just digitorum.
Digiti minimi is going to be ulnar to the digitorum on the pinky.
The one that's more on is the
Do you see
ED.
how I have two here too?
Oh.
These two?
Yeah.
You've
Yeah,
got
you
two.
have two as well. That's so the one that's more ulnar is the
On my
digiti
bag.
minimi.
Okay, and then the one that's more medial was the
Digitorum.
just the digitorum.
And then ready, watch this one when I go into this.
So these two don't have their own. That's why you can't kind of isolate their extension.
is more
For the second metacarpal though, it's
Oh.
the one that's more ulnar, you said, as well?
They're
Okay.
both more ulnar.
There's none on the
Okay.
So whatever colors, the middle side is the digitorum.
All right, everybody got that?
Yep. Is the one with
Alright.
the EDM.
So now it moves into the intrinsic muscles. Okay, so extensor digiti minimi. So they're both, see how this, so the same thing, when you kind of isolate these, right, we have two at the index finger. No, more ulnar. They're both more ulnar. They're ulnar. So at the pinky, see how I have two tendons here too? Do you see them? So you just kind of have to have them wiggle around. This is your extensor digiti minimi, small digit.
And what's the EI?
The EI, extensor indices. So you have two, you have these two have their own extensors.
Okay.
Do they both
So
have
they can-
EDM and
They,
EI?
no, so
EI
T,
is just
yeah.
I.
Indices is index finger. So they have their own, right? So they all have an extensor digitorum, which does all of them. And then there's an extensor indices, which is just for the index finger, so you can isolate this. And then you have the extensor digiti minimi, which isolates the fifth digit extension. So you can put these up, but you can't put these up on their own because they don't have their own. So just index finger and small finger, digiti minimi, indices, okay? And then when you're looking at those, they're both more ulnar to the extensor, they have extensor digitorum too. So they have two tendons. The index finger and the pinky finger have two extensor tendons. Two long extensor
Where
tendons.
the third and fourth only have one.
They only have one. They only have the digitorum. Okay. And the ones that are special, so the indices and the digiti minimi, are both located ulnar to the extensor digitorum. So you find the two tendons, and then you palpate it, and it's going to be the tendon that's ulnar, on the ulnar side.
Can you show us an Annie? Because hers are not as prominent.
Sure. So, claw, like a little bit more. Yep. So, hers you can't see, but you can feel. So I feel here and here. Do you feel them? Yours are thinner. Do you feel like the difference between there and there?
Not when you push it in, maybe I do.
So on the index finger.
You see how there's 1 and 2?
Yeah, I can see it now when you pull up my hat. I can see it.
You see it?
Yeah.
And then the same thing here. So that one's gonna be, and I'm sorry, I heard somebody
I was
ask
just
a
saying on
question.
the
Yours is
index
here and
finger,
here.
it's like on the inside of the hand.
It's both
on the
of them are
ulnar
ulnar,
side.
yeah.
And then this one's on the outside.
Mm-hmm.
So there's one here, and there's one. You feel them?
And they're both ulnar.
The isolated ones, like the indices and the EDM, are both located ulnar to the digitorum. So the digitorum's like, yeah. Maybe. Wiggle. Yes, you do. Very good. Yeah. You do. Yep. Very good. Dan's here. Okay. Intrinsics. Alright. So, the abductor pollicis brevis, opponens pollicis, and flexor pollicis brevis, those 3 make up your thenar eminence. Hi, Dan.
Hi.
How are you?
Good.
Good to see you so early.
That's too early.
So the thenar eminence is this muscle bulk at the thumb. Okay, so thenar pollicis, you're gonna think thumb, okay? This is your hypothenar eminence, this is your thenar eminence. So this is the palm muscles. So those 3, abductor, opponens, and flexor, it's in that same order, working outside to in. So if you see this muscle belly, right, kind of how it comes all the way around, this is your thenar eminence. If you have her abduct, like bring your thumb out this way, yeah, this part of it, this muscle bulk, is your adductor pollicis brevis. Abductor pollicis brevis. This part here.
So she's adducting the thumb.
Yeah, so abduction is this way.
Right.
Away from the palm, yep. And it's gonna be here.
Abduction, right?
So it's like, that's extension. This is abduction. So this bulk here,
Oh, right. Abduction.
this bulk here.
Okay. Abduction. Yeah.
So, but abduction, you guys, this is extension. This is abduction, away from the palm.
Oh, okay.
Okay, for the
It's like
thumb.
this.
So it's this muscle bulk here. So right, you have the shaft of your metacarpal. This is your abductor pollicis brevis. So this is the shaft of your metacarpal. This is your abductor. Okay. So shaft, abductor. Shaft, and then abductor muscle. This guy here, that one. What? You can't find it? That's okay, I'll help you. So, yeah, because your thenar is kind of small. So this is your thenar eminence. Your abductor is this guy here, this little ball. And you would bring it out this way. Yeah, it's this here. So this muscle bulk, right there.
It's like along the shaft.
So bring it out. Yeah, but do you see, so this is her shaft,
My
and this is her
fingernails.
abductor.
I know.
This
Every
is
boyfriend I've
the-
ever had has been like, oh my god, you have such long fingernails. Every boyfriend, because they all have big fingernails.
Because of climbing, though, right? It's like when you
Oh,
dig
maybe.
into the rocks. What?
That's true.
Right?
What? No, my fingernails have always been
were
small,
like
but
that.
they're never
Every
long.
time from you to rock climb, I feel like it pushes and you
Maybe. Because my toenails changed when I was doing a lot of salsa and I was wearing like heels.
Oh, Corey. Okay. Maybe find out.
Salsa
dancer.
Yeah,
That's cool.
So we were on these, we only really went over like this.
abductor, right? So the other muscles of the thenar are eminent. So the flexor, so this is thumb flexion. So when you look at, like, see the round of her thenar eminence, yeah, this is the flexor, kind of makes up this border, and this is your abductor, makes up the other border. So this is the thenar eminence, this is your abductor, this is your flexor on this part here. So on mine, because mine's prominent, this is my flexor, this is my, you see my muscle bulk from the abductor, and you can see it outlines. My flexor is gonna come from here, this is the flexor, this part. Now, even, so you see muscle, do you guys see like muscle, there's a muscle?
Right.
Do you see how it has a dip in between on mine? So I don't know if everybody's is like gonna be as defined, but I know. I do a lot of like work. So that dip in between, deep to that flexor, to that abductor, here's the abductor, here's the flexor, deep to that, in between those two, there is like a space, that's the opponent. So this is opposition. You gotta kind of play around where those muscle bellies are, have them oppose, and you'll feel the palpation deep. You'll feel the contraction deep. So kind of finding flexor, there's your flexor, there's your abductor, and it's gonna be, I'm sorry if my fingernails aren't prepared for this, in there. Underneath those two. Yeah, you feel it? Okay. I'm like, do you get it?
Like contract, right?
Yes, yes. It'll be the one deep that will be contracted.
Do you have to like really dig?
Not super deep. So there's your abductor, flexor,
It just comes up, right? Just, well, not comes
Yeah,
up,
it
but you
does.
feel it come up, like it contracts.
between like the two. You got it. So that's your thenar eminence. And then, so you see this is your thenar eminence, this muscle bulk here. So your adductor pollicis comes from the third metacarpal and it inserts into the base, into like the MCP joint here. This muscle bulk, that is your adductor pollicis. That's gonna adduct. Yeah, bringing it in. So you can feel the contraction here, or you can just kind of see, like, is this your lifeline? Kind of outlines it. It's gonna be the bulk in here. This is the lifeline, right? Yeah. They say mine's long. Look how long. So.
Annie's gonna die young. Diagnosis, Dr. Corey.
Very based on really, supported methods.
Science, evidence-based.
If you go this way too, that kind of bulk. But that's the adductor pollicis. All right, your lumbricals. So your lumbricals are responsible for MCP flexion and PIP-IP extension. You could really only palpate the first one, which is gonna be, let's pull up a picture.
I'm sorry, can you repeat that again? Responsible for MCP
Flexion.
Flexion,
And
IP,
Extension.
That's an important concept. Yeah, they're so important to function. I'm trying to find, I don't care about my hot nail.
I might be able to. Would that be helpful?
Okay. So, if we're looking, this is your first lumbrical. So it's gonna come from the palmar side and cross over into extension here. So just so that you can see, so we know where our metacarpal is, right? This is the muscle belly that we're gonna be palpating for, right along that shaft. And if you look where the bulk of that muscle belly is, it's gonna be more towards the bottom, towards the base, yeah. So this, but again, knowing the motion. So the adductor pollicis can get in the way of palpating this. So I usually stretch it, put it onto slack, right? So that it's not contracting. So the adductor pollicis would bring the thumb in here. So I'm gonna put the thumb out of the way into flexion and abduction so that that's not in the way. Now I see Annie's metacarpal here, right? I'm gonna have her bend kind of like, but see that adductor wants to come in.
Tries to try to relax my thumb.
Yes, have them like relax that thumb. And I feel it there. Do you feel that? That muscle contraction here? So this is where you just have to feel for the contraction. But when she initially did it, she wanted to like meet it this way. So you just gotta kind of get that to relax and then palpate in here and have her just.
Thumb down.
Yeah.
You can like hold it down just so
Yeah.
you can relax. Because you don't want the adductor.
So she's pulling on my metacarpal. You're pulling on your phalange. She's pulling on the metacarpal.
So try not to press it. Yep. So, and then the outside here. Yours is very good. Yours is tight. Go ahead. I feel it. Ooh. Do you feel that muscle? This is your adductor. That's like that. It doesn't massage. You do. You should probably report the practical.
No, I yeah. You know how you were palpating and you couldn't find like any of my muscles because they were like pushed back here or something?
Right.
They were my other hand during the practical.
Yeah.
Okay. I want to pull up for. So interossi, what would that mean? Between osseous, so it's osseous. Bones. So these are your palmar interossi. So we remember there's also dorsal interossi. So we know this is palmar, this is dorsal, right? So we're gonna feel the palmar interossi on the palm. So pad and dab, I want you to remember, because palmar adducts, pad, dorsal abducts. So pad, so the action here is MCP adduction, pad, okay? Now if we look at where these are, they're interossi, they're gonna be between the metacarpal. Looking at, so this is the head of the metacarpal, right? And where's the muscle bulk is gonna be closer. You're gonna feel more of the palpation like kind of right underneath. You can see this is the head, right? You're gonna feel that palpation kind of underneath the head and you're gonna just have them, let me feel it, adduct. And you're gonna feel like a little twitch. I mean, you can palpate, if you look, 2nd, 4th, and 5th. What happened?
There's none on the third.
There's none on the 3rd. So you have to know where they are. Adduction is bringing the 2nd, 4th, and 5th digits towards the middle finger. The middle finger has 2 dorsal interossi because it cannot adduct to itself. Okay, so you have to know which fingers have palmar interossi, which would be the 2nd, 5th, and 4th. So you can palpate it there on those shafts and kind of knowing that it would be on the shaft, the side of the shaft, near the head, that's kind of towards the middle finger. So on the 2nd, it's gonna be here, but it's not gonna be on the ulnar side of like the pinky. It's gonna be on the radial side of the pinky because it's gonna be adducting towards the middle finger. Does that make sense? Okay. Oh, flexor digiti minimi brevis and abductor digiti minimi brevis. Those are, so that's this border here. This is your hypothenar eminence. This is, yep, there's Annie's hypothenar eminence. So it kind of mimics, right, your thenar eminence, right? You have an abductor pollicis brevis, you have an abductor digiti minimi. So just like kind of opposite, this is your see how it kind of has, like again, that's your flexor, that's your abductor digiti minimi. Make sense?
Can you say that again?
So 5th digit, so if you look here, abductor digiti minimi is that bulk that it's gonna abduct the pinky, right? So it's gonna be here. It's gonna be just like the pollicis, like opposite. And then you have a flexor. So with your hypothenar eminence, it's gonna be the one that's here. You can just kind of have them do MCP flexion, but you can even just kind of visually like see there's really, yeah.
Have them flex for both muscles.
Just have them kind of, yeah. And then this is gonna be your abductor, and then where that dimple is your flexor. Here. So the one that's gonna abduct is gonna be this bulk on the side. And that those two, yes, make your hypothenar eminence. So you see those? That's gonna be this bulk here.
And that the first bulk is the flexor digital.
Yeah, this is the abductor, so the one on the outside. Yeah, so that's your flexor, that's your flexor. Yeah. Flexor here, so this is my abductor. That's the abductor. This guy. Might be easy to just feel this way, but if you're doing it, this would be the flexor. I'm ready for the beach. Flexing, yeah. But the abductor, you could tell, is right here.
Yes. And then the flexor is in here.
So you guys like flexing the tiny things.
What happened?
The fingers, I was imagining.
All right, dorsal and thoracic. So that's gonna be your posterior intrinsics. So those are all right, most of your intrinsics are on the palmar side. So your dorsal and thoracic, we're gonna kind of do the same. Difficult, let's look at a picture too of this one.
Your hand sanitizer is expired. Just so you know.
Okay, thank you. I'm still gonna pretend it works. But I will fix that. All right, so this is the back of the hand. Now, kind of similar shape. So over here, right, our lumbrical is gonna kind of come in here, be like underneath here, and then the adductor pollicis is gonna come and insert into this MCP joint. So the adductor pollicis is here, the lumbrical is kind of underneath here, and this guy is gonna be on the top. Definitely much more prominent towards the base.
So adductor pollicis you'll feel more up here, and the lumbrical you'll feel more down here.
The adductor pollicis, I say just kind of find your lifeline, feel it here.
I'm sorry, what was the one that you were doing this for?
That's the lumbrical for MCP flexion.
So how will you know the difference between the lumbrical and the dorsal and
The
thoracic?
dorsal and thoracic, the action that you'd have it do, and you can have them, you can play around,
Okay.
like kind of between the two motions and figure. So this one, dab, right? Dorsal and thoracic are gonna abduct. So again, I kind of quiet, get anything else out, and I have you wiggle this way. So quiet in here. Yeah, that's it. And then flex for me. Like this way. So I do feel that more here, and then abduct again. Do you feel the difference? I feel it's bigger, and it's gonna be superficial. And then lumbrical again, I feel more there.
I can see your fingers moving more depending on which one I'm doing.
Yeah.
Like if you have both your fingers on there, I can see them moving more.
Okay. And that's it. Practice that.